Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining me is Dan Greenleaf, CEO of ModivCare, to discuss the strategy behind the company's recent name change from ModivCare to ModivCare. Dan, it's great to have you with us on Trade Talks. Welcome to the show.
Thank you, Jill. Glad to be here.
And what does this mean for ModivCare, and what's the strategy behind the name change?
Well, a big part of the strategy is that we're changing the direction of this company. And part of that change in that direction has to do with our desire to elevate the patient's experience and our desire to become much more consumer friendly as an organization, and our desire to move from a company that's focused on transportation and logistics into a company that's very focused on social determinants of health. And logistics is part of that, but so is food, so is personal care. And we bought a company back in November called Simplura, and the reason we purchased that company is because they afforded us an opportunity to get into the personal care space for the patient populations that we currently serve.
And let's talk about the outlook for 2021, because of course 2020 was an unprecedented year. So what's your outlook for 2021 within the personal care space?
Well, I'm very positive about it. I think what we've seen is that more and more care is going to be delivered in the home. And we're, if you will, a facilitator of that. We're a facilitator of that through transportation. We're a facilitator of that through food delivery. And then we're also a facilitator of that through personal care. And as our population continues to age, as our population continues to require more demands in terms of the types of care they're receiving, the difference in terms of the cost if a patient is institutionalized versus in the home is significant. And I don't think anybody's waking up to this, but I certainly believe that the time has come. The time has come for more appropriate care to be delivered in the home, and we're in a very unique position to do that.
Right, so it sounds like this isn't just a trend as a result of COVID-19. This is something that is longer term.
It is longer term, but I would also say is one of the things we're most passionate about is addressing the inequities that exist in healthcare. And one of those inequities is transportation. So in other words, if you don't have access to your doctor because you don't have a means of getting there. Another inequity is food. Imagine what a person goes through when they don't have food on their plate or have food in the home. And imagine what they're thinking about on a day-to-day basis. And then the third one is having somebody there to provide care for them. And what we have seen as a result of COVID is the gross inequities in our healthcare system. And what we are committed to do is addressing those inequities. And by bringing these three pieces together, transportation, food, and personal care, there isn't anybody in a better position to do this going forward.
All right, Dan, we appreciate the insight. Thanks for all the hard work that ModivCare is doing. And thanks for joining me on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.